In this presentation, we will be mentioning the major differential diagnosis of various uveitis presentations, and I will be mentioning the major uveitis entities and the common patterns of intraocular inflammation with which these major uveitis entities usually present. So less common uveitis entities and less common presentations of common uveitis entities will not be mentioned. So non-granulomatous anterior uveitis can be due to non-infectious entities like HLA-B27 associated anterior uveitis, in which we have ankylosing spondylitis, Retard syndrome, psoriatic arthritis and inflammatory bowel disease, glaucomatocyclitic crisis or Poschner-Schlossman syndrome, Fuchs uveitis syndrome, GIA associated anterior uveitis and Behçet's disease, which is actually a pan-uveitis but may present only with anterior uveitis. Infectious entities which can present with non-granulomatous anterior uveitis include syphilis and herpes viruses such as HSV, VZV and CMV. Masquerade syndrome should be considered in the differential diagnosis of almost all uveitis patterns. Non-infectious entities which may present with granulomatous anterior uveitis include lens-induced uveitis or phacoanaphylactic uveitis, granulomatous pan-uveitis such as sarcoidosis, Vogt-Koyanagi-Harder syndrome and sympathetic ophthalmia, and infectious entities such as tuberculosis and syphilis. Non-infectious entities which may present with intermediate uveitis can be multiple sclerosis and sarcoidosis, but most intermediate uveitis is idiopathic. Infectious entities which may present with intermediate uveitis include tuberculosis, syphilis and Lyme disease. So tuberculosis and syphilis are there in the differential diagnosis of almost all patterns of intraocular inflammation. Non-infectious causes of retinitis and retinochoroiditis include Behçet's disease, and infectious etiologies which can cause retinitis or retinochoroiditis include tuberculosis, syphilis, herpes such as HSV, VZV and cytomegalovirus, toxoplasmosis, Bartonellosis and diffuse unilateral subacute neuroretinitis. Choroiditis and chorioretinitis can be caused by non-infectious entities such as sarcoidosis and the large number of entities called white dot syndromes, in which we have acute placoid multifocal posterior pigment epitheliopathy, serpiginous choroiditis, amphigenous choroiditis, persistent placoid maculopathy, multifocal choroiditis, punctate inner choroiditis, subretinal fibrosis with uveitis, birdshot retinochoroidopathy and multiple evanescent white dot syndrome. Infectious entities which may present with choroiditis or chorioretinitis include tuberculosis, syphilis, histoplasmosis, cryptococcosis and pneumocystis. Cryptococcosis and pneumocystis occur almost exclusively in patients with immunosuppression due to HIV/AIDS. Infectious etiologies of pan-uveitis include tuberculosis and syphilis, and non-infectious pan-uveitis entities include sarcoidosis, Behçet's disease, Vogt-Koyanagi-Harder syndrome and sympathetic ophthalmia. Retinal vasculitis due to non-infectious entities can be Behçet's disease or sarcoidosis, and infectious entities causing retinal vasculitis can be tuberculosis, syphilis, Bartonellosis, leptospirosis and cytomegalovirus. The major differential diagnosis of neuroretinitis are mostly infectious and include Bartonellosis, tuberculosis, syphilis and toxoplasmosis. Differential diagnosis of exudative retinal detachment include non-infectious uveitis entities such as Vogt-Koyanagi-Harder syndrome and sympathetic ophthalmia. Thank you for listening.